We are starting this lovely interview sequence, whatever, what have you, block for our alumni page. And I have one of my fellow classmates here with me, Luke Rosendale, to start us off. Today, we're going to talk about questions in regards to residency. So, Luke, can you just give like a little intro about yourself and the residency that you're in and all that jazz?
Yeah, sure. So as Ali mentioned, my name is Luke. Of course, we graduated in 24. Yeah, that's
Mm.
crazy. It's been a whole year. But uh, but yeah, so currently working at the Cleveland VA, currently at the Parma branch right now, and completing an orthopedic residency, which a little more than halfway through it, I'll be done at the end of June. So yeah, it's coming along nicely though. But yeah.
Ooh. So with the Cleveland Clinic, what kind of, I think, is it more, I guess my question is, what type of patients do you see? I know you said orthopedics. Is it more geriatrics, more middle age?
Yeah, that's a good question. So with the VA and specifically Cleveland, the Cleveland, or I guess the Northeast location, their locations, it's a little more geriatric in nature, and we consider our geriatrics 65 and over. So I know that kind of varies here and there, but 65 and over is considered our geriatric population. I would say I tend to have, yeah, middle-aged to geriatric. The youngest patient I've had to date is probably, I think he was 23, and
Oh,
that
wow.
was like a pretty rare occurrence. So not even really that young, but yeah, no peds or anything, no like real like late teenagers or anything like that. Um, but typically more of the male population, and then more so like after the age of 50. And one of my oldest patients, he was probably like, I think he was like 92. He was still, yeah, he looked great. He was doing good. But yeah, more orthopedics in nature. So the Cleveland VA, they have a geriatric residency and they also have orthopedics. I believe they're working on a spinal cord one. Don't quote me on that. It's like in the talks, I think. But uh, but yeah, right now our class of orthopedics, there are four of us for orthopedics, and then there's one geriatric
Okay.
resident. Um, so yeah, they're awesome. Love to hang out with them. Um, and yeah, I guess like more of the patient demographics, being veterans, we see a lot of low back pain,
Mm.
a fair amount of neck pain, so a good bit of like spinal stuff, and then a lot of shoulders, rotator cuffs, and your typical like knee replacements, hip replacements, stuff like that. Not very like sports in a way of like there's not a ton of ACLs, nothing real ligamentous in the knees too often. Not a lot of like hip labral repairs. Haven't seen like any of those. So more of just your like more chronic conditions of like low back pain, neck pain, rotator cuff pathology. Those are kind of like the big three that I see. Um, so yeah, if that kind of answers a little bit of your intro question.
Oh, yes. Okay, so we talked a little bit about what residency, the patient demographics, all of that. So, can you give us some insight as to what made you want to pursue a residency immediately post grad?
Yeah, sure. So obviously going to PT school, having clinicals, it was always good to get different input, education, advice from, your CIs, your professors, your adjuncts, some of the old alumni came back to teach us. So that was always good too. And a lot of them had certifications like OCS, CSCS, GCS, stuff like that, and even fellowships. So I was like thinking, oh, okay, like what is that? I'll look into it. Uh, and I know it's just hard because PT school is kind of like the catch-all. You learn everything, and you just take that
Mhm.
giant test, and it's like you kind of, drink from the fire hose a little bit with everything, and not one thing is super specific, even though we all have our niches that we like. So I liked orthopedics a little more than the rest. I know it's like a common answer because everything in of itself is kind of ortho in a way. But yeah, like specifically just seeing some of our professors and some of our CIs, just how knowledgeable they were and how like well they provided education for us compared to other people that I've learned for. from. I was like, wow, like they really know their stuff. It'd be nice to kind of take in as much as I could sooner than later for me, like personally. I think it was more just a thing like, hey, I'm in the mindset of still doing schoolwork. Like, yes, I know we went to school for a good 7 years now,
Mhm.
but I don't know how I would feel if I like, started working in the real world for a year or two and then like if I'd want to go back into, schoolwork and having to take exams, stuff like that. So I was like, I might as well do it now because I'm interested in it. I just think I'd be in a better state of mind now than I would be, later down the line, however many years it might go by. So that's kind of why I chose right after school. But having done this, I don't think there's a wrong time to do it. Um, so out of the five residents, three of us graduated in 2024, or I guess we all graduated in 2024, but the three of us did that, and then two of us a little bit older, um, like early 30s and then late 30s. So they were working before. One was in the service as well,
Mhm.
and they kind of came back around to do the residency that way. So yeah, I don't think there's a right or wrong time. I think me personally, I was in that kind of like continue learning type mindset. So why not do it now? But yeah,
Fair enough. That's a good kind of, you're already in the drive of things, so continue that
yeah.
on.
What's a few more like long tests? Or I guess one more long test.
That's true. Okay. Can you kind of describe the application process, or I guess when you were searching, if you had a specific, oh, yes, or if you knew, I guess, I want to do the VA, or this is, I want to do orthopedics. Let me narrow down that kind of thing. And then going into the application process.
Yeah, for sure. Yeah, I think so. The application process of it itself is through PTCAS. So the same thing we all did to get into PT school. It's called RFPTCAS. So Residency Fellowship PTCAS. So they have their own little like section of it, but it's the same exact thing. You kind of like, Google search or search um, what schools or what areas or regions, or not schools, but what programs have um, residencies. A lot of them have multiple. So I saw a lot with like the peds, the orthos, and the sports were very common together at like locations, and then like other locations that had geriatrics also had a lot of spinal cord or like neuro um, residencies kind of together. So the VA was interesting because it had like one of each that I kind of saw at other groupings, but yeah, so I kind of just looked in the region I wanted to stay in, so like Northeast Ohio region. Um, there's one at the VA. Ohio State has one in Columbus, which is cool. There's a few in Cincinnati that I looked at as well, but I didn't know if I wanted to go that far for it. I was looking at a couple in Virginia, and then my hometown is in Pittsburgh, so I was looking there as well. UPMC has a decent one, um, and they're all like affiliated with some sort of college as well. So like the VA is in cahoots with why am I drawing a blank? University of Ohio, or Cleveland State. Cleveland State.
Even
Yeah,
so, I was,
Cleveland
well,
State. Cleveland State. Yeah, you're a little bit further out there. Yeah, Cleveland State. Yeah, so the Cleveland VA is in cahoots with Cleveland State University. And then like the Pittsburgh one was the UPMC one was with University of Pitt. Cincinnati one was with the Cincinnati Bearcats that I looked into. So yeah, it's just interesting that like obviously coming from Mount Union, we don't really have an affiliation, but for the Cleveland State students, they have a little more insight into it with some stuff like that, which was just interesting to think of. But yeah, the process is pretty easy. You'll go through their requirement program, so like or the requirements they'll offer. So it's like give us your resume or your CV and then like explain a paragraph or stuff like that.
mhm.
So all the same stuff. And then some of them have different prerequisites too. So ortho, you didn't need any prerequisites for the sports ones, just because I was looking into the sports ones too. The sports residencies, you need I forget what it's called, but it's some sort of like sideline training for like an emergency
Uh,
type deal, like an athletic trainer would kind of do. I forget what it's called, but like you get to
mhm.
do like a weekend course and it costs extra money and all that fun stuff. But more, you can handle a situation like that. That's more like an on field, like if someone kind of like has a loss of consciousness, big hit or something like that.
Yeah.
or they blow out their knee and like they're going into like a shock or something like that. Yeah, so it's like more like a triage type. So you need like that certification, and I'm not really sure what if the geriatrics or the neuros need anything specific either. Sorry, but I just know the sports one needed that because I was looking into it. I was like, I don't know if I want to do that whole weekend thing because like they're offered around the country and they're not cheap and they're like only certain times of the year, they're not like readily available. So it was kind of hard to kind
Mhm.
of plan around schedules. But yeah, or it's like EMS certified, like stuff like that. So if like you're an EMS or you work as EMS, it's easier to kind of get into it like that. But anyway, so yeah, the process is pretty easy. Um, it took me a couple weeks, and then I applied, and then they got to me earlier than they said they would, so that was nice.
Okay.
Kind of gave me a better idea before taking the test, the big exam.
That's true.
But yeah, so hopefully that can answer it. I know it's kind of all over the place, but
Oh, I think that's good because then, I mean, you can speak more to your own residency and what you were while you were applying and looking and everything like that, what you were experiencing too.
mhm.
I don't really know if we have anyone that I know of who's done a sports residency, but that's neither here nor there. uh,
So I'm not sure either. So yeah, it's all
oh,
good.
yeah, I'm not sure. All right. So in regards to the program setup, I was like, I know every place is different. I've heard that some residencies are more like almost like a PhD in a sense of you have to do X amount of teaching and classes, and then you do have some clinical time. What kind of, I guess, on a daily or weekly, I guess, basis, what does your schedule kind of look like, or what requirements are being asked of you throughout the residency?
Yeah, yeah. So it can be a pretty loaded question. There's a lot of specifics that go into it, and of course, every program has their own like curriculum that you need to kind of abide by to sit for the OCS or the SCS or whatever you're going to take. Specifically at the VA, I guess my like week to week or month to month kind of looks like. I guess we'll just kind of start with the mentoring or the didactic days. So every first and last Tuesday of the month, that is a didactic day where we just sit in a big classroom, lecture all day, throw a lab in here and there. And like those 2 days are dedicated to either all day lecture or all day lab or kind of just a mix of both. We'll have pre-tests and post-tests just to make sure we like learned. Um, and then we'll also have dedicated presentation days too. So like that's kind of on those days. We'll just kind of present like case studies that we're working on, or like they call them our journal clubs. So they'll give us something to look into. We have to research it, find all these articles, all that fun stuff, and then just kind of present it to the group with so like the most up to date kind of EBP. So that's always a good time. It's pretty laid back and nice. Like everyone's super helpful. And you're not like presenting to like everyone's supposed to show up, but it's never as big as what you want, right? So it's like it's not as nerve wracking as what you would think it is. Like, oh wow, the VA is pretty big. We got to present the whole thing, but that's not that bad. But yeah, so those are our first and our last Tuesdays, and then every Tuesday in between, so the middle 2 Tuesdays of each month are mentor days, specifically where it's like one on one with a pre-chosen mentor that you get to pick early on. So I picked a total of three. We get like 3 months each, pretty much, or sorry, 4 months each out of the year long program. So yeah, I'm almost ending on my second mentor now for the last one here soon. But anyways, so that just looks like a typical work day. So we'll see patients and kind of talk about the cases. They give us extra time though. So at the VA, the time frames are pretty quick. So you get like 30 minutes for a treatment and then an hour for an eval, which is nice. On mentor days, it's still 30 minutes for treatments, but you get an hour and a half for eval. So kind of dig a little deeper per se with your mentor, kind of like one on one. So that's nice. So it's less patience that day, more education, more like hands-on feedback and like trying things real time on patients instead of just like your other fellow residents, which is kind of nice. To actually treat someone who has, an issue or an impairment rather than like a healthy, younger, pliable resident who's not like stiff. Um, so that's always a fun time. Yeah, so those are the like learning of the didactic days, and then the other days are just regular treatment days. So kind of like learning on your own. Um, and then the coworkers are pretty much like a lot of them are all mentors, so they all have their extended fellowship, OCS, GCS, all that fun stuff. So they're very knowledgeable. If you ever need help or have a question, they'll give you like 20 times more than what you asked for, which is nice. It's good. It's not just like a one word answer or like, oh, it depends. Like, we'll see you soon. They dig deep, which is nice. So that's just nice. I think it just kind of shows at least at the Cleveland VA, the program there. They got a good group of workers there. But yeah, and then as far as like the residency or as a resident schedule goes, it is a little less patients treated each day. So a full-time employee treats 12 with 3 evals and 9 treatment slots. I only see 2 evals and 8 treatment slots. So it's only one less patient, but the last allotted like half an hour to my day is just used for like research, documentation, looking into my presentations, extra learning from everyone else who is still done with their day too. So it's nice to kind of like take my time on notes, kind of relax, not like just jumping right into the workforce and just like cramming out like 25 patients a day at some places. So it's a nice schedule there. I can't really speak for other programs, but it's pretty good there to say the least. So I can't complain. And then as far as like other requirements, we have to give presentations, like I said. We are also affiliate with Walsh program of like a mentorship of our own. So the Walsh students will know they have like community days or a community clinic. It's coming up in April. We did one at Mount Union for that one day. They have like a 3 day stint where they have their first years and third years. I think the first years treat, the third years watch and like help, and then we're there kind of just like to help guide as needed type deal. Um, so that's considered a mentorship thing. We did a presentation for them as well on like what is a residency type deal. Um, I guess I forgot to mention that. Yes, we're affiliated with Walsh too, and not just Cleveland State. Um, but yeah, so some of that, and then like recently we did a presentation for the APTA. It was like allotted for CEUs, but like it was a VA type thing. It was every VA in the nation. A couple of the residents from like each location got to present on a case report.
Okay.
So that was cool. So yeah, all of ours got accepted from the Northeast Ohio, and then a couple others from out the country got to go to. So that was cool. Um, but yeah, that kind of goes to all like the teaching, mentoring, presentation, all that stuff that you need to take the OCS test if you don't do a residency. So they cover your bases. They make sure you get all your stuff done. We'll all be good to go when the OCS comes around instead of having to like rush or double check things. Like it's all kind of taken care of for you, which is like a nice bonus of that.
Check the boxes off.
Yeah, pretty much.
Okay, we already talked about patience. So I guess this next question in regards to how you feel and once you are done with this, your preparedness for clinic, like I guess the big world out there in the clinic post residency, like how has residency helped prepare you for when you're done, when you come out to the real world?
Yeah, no, that's a good question. I think honestly a good bit. I know it's like a cliche answer. Um, but yeah, like even in clinicals, you always second guess yourself here and there. Your caseload's lower, it's nothing, you don't feel too confident with things. You always have help around and stuff like that. So I kind of looked at it as like an adjustment period where it's like, hey, I'm getting more independent as a clinician, but I also have help if needed. And it's more just like you know, day by day, like let me go through a whole day, treating a whole caseload, see if I have any questions type deal, rather than like someone honing in on me all the time. And I think that has helped me kind of grow where, like, because if you go to the real world, you don't know how like much help you'll have from your coworkers, if they're going to help you at all, like what the, cohesiveness is around your clinic. Um, so this is a good, like, I like to call it like a transition year of becoming even more independent, more knowledgeable, more educational clinician myself. I think it's helped out a lot. And like for me personally, I would get like pretty anxious and nervous to do evaluations on like low back pain, for example. That was like a big one because like it's a lot into it, right?
Mm.
Um, when I was a student and I had a CI and I felt like I was just being graded, but now that I mean, I guess the VA is different. There's a lot of low back pain, so I've seen it a lot more now. But I feel way more comfortable seeing a chronic, highly irritable low back pain. That's been through years of service. It's like these patients are very irritable and in a lot of chronic pain for years. And that used to like scare the crap out of me if I saw someone like that come through my clinic. And nowadays I just feel a lot more confident. I'm able to kind of calm them down a little bit, provide more education that I would get, at school type deal. Um, yeah, I don't know. It's definitely helped me a lot kind of grow in just a short amount of time. People say it's like, oh yeah, if you do residency, you're like 5 years ahead. I don't know if that's the case. I think anyone could, go learn as much as they want without a residency. If you put
Mhm.
the time in, put the work in, like you can do really good. But I do feel personally a lot more confident in myself as an individual, like provider, if need be, in the future, if I ever went and started my own business or whatever, like I feel way more confident in making sure everything is safe, knowledgeable, and I'm giving the best care I can kind of give. And I think it just helps getting that constant feedback like daily, on what I could do better, what I'm really doing good with, all that kind of fun stuff. So I know that's kind of a long answer,
That's a good answer.
but yeah, I feel better for sure. So yeah, if anyone ever has doubts about themselves and they're interested in it, definitely go for it. You'll feel a lot more confident coming out. But then again, you can always do it on your own too. Like there's no right or wrong. I'm not, you know what I mean? Uh,
It's a
but
more,
yeah,
I think, more structured and like kind of, I guess, a safer place to learn rather than in just relying on your coworkers who are drowning in their own workload. And
right,
so,
right. Everyone is like willing to lend a hand and give you everything that they know, so you can kind of just add it to your toolbox, and you have even, more than you did the day before type deal. So yeah.
which a great lead up to my last question. What advice do you have for those considering residencies?
Yeah. Great question. I think everyone should probably ask themselves that too. If you're considering it, like, hey, what am I gonna get out of this? It's good to always try to find someone who went through it and pick their brains or go shadow someone. So, for example, I had a clinical in Cincinnati, and I went and shadowed the Bearcats guys at the sports, and they were super cool. But I kind of realized that like the sports wasn't really for me as far as the traveling, being on the road, just kind of like tending to the athletes hand and foot for whatever they needed, not even PT related. So that was like something that was like, it's like you're kind of like the water boy, kind of getting like hot towels, stuff like that. It kind of like, you know what I mean? Like, which
Yeah.
it was cool. Like you're a part of the team at that point. So like, it's definitely their own thing. But I was like, I don't know if I can devote my weekends to traveling with the team, and if I'm that like into that type of stuff. But I did like, the ortho sports realm of it, and but yeah, so it's always, yeah. Sorry, kind of circling back, but it's good to kind of get a view of someone who went through it or someone who's doing it currently. Um, and yeah, like just think about if you're willing to devote, that year or however long the program is. They're usually a year, maybe like 18 months, year and a half. If you're willing to devote your time to just, making yourself a better clinician, through a more structured route. So again, not to say you can't do it on your own. I think anyone could do it on their own. Take courses, take free courses, learn from social media, learn from the internet, all that fun stuff. Read every research article. Like you could very well learn a lot on your own too if you're not willing to, complete that full year during an actual residency. But again, it's just a lot of work. And if you want to do the OCS, you just got to kind of manage it and keep track of all your stuff. Um, but yeah, I would say go for it, but definitely do your research. So obviously, like place, location, timing, life, all that goes into factors too. So if it works out for you now and you want to do it, great. I say go for it. I don't think it can hurt you. But if it's not now, you can always revisit it later too. I know everyone kind of already knows that, but yeah, I would say it's been a good experience, and I wouldn't second guess it if you're like on the edge. I think it's a good thing to do. But if you're kind of on the edge, you're like, ah, don't know if I'm gonna devote my time. I think I can do it on my own. Kind of like how you study for the boards for all those months. Kind of a
Mm.
similar thing to that too, but there's, the payoff is just being more educated per se, more knowledgeable. But that's with anything in life. So sorry, that was a weird
Ooh.
answer too.
I think it was fine. Well, I think that is all of the formal questions that I have.
Oh
So,
gosh.
no, that's all I got for you. Uh,
Okay, sounds good.
so, thank you so much for coming and letting me interview you for our first attempt at this, and hopefully, it is at least a little beneficial for anyone who watched it. So,